Welcome out there to another wonderful episode of Nurse to Health, brought to you in collaboration with the Hofstra Northwell School of Nursing and Physician Assistant Studies, and always with the amazing support of the best in the business, station manager John Mullen. And I am joined here and incredibly happy to have her with me, Amy Smith. She does a lot of really good stuff. So welcome, Amy.
Thank you so much for having me.
We're going to be talking about some very serious stuff that doesn't get talked about quite enough. The issue of domestic violence, the single biggest cause of homicide against women.
Growing up, I certainly was not reared to talk about intimate things publicly. It carries a kind of this tag of shame.
Taboo?
Yeah, like it's a taboo subject. We don't
Right.
talk about it from a pleasurable sense, from a violent sense. We don't talk about it like that. And I think as Americans, we're very uptight that way. And I'm not excusing. I think it's disgusting that they don't talk about this, knowing that it is a really significant crime in New York and everywhere. But in New York, you know, in my experience, which is now 17 years doing this is not something that people want to talk about. It's not exciting. You know, people feel uncomfortable. My husband always jokes with me and says I'm not fun to take to parties because, you know, when people ask me what I do, and I deal specifically in the acute treatment of domestic violence as well as sexual violence against anyone, they politely will, you know, excuse themselves because that's not something that people want to talk about. But I think they're wrong. I think it's something we should be talking about.
Yeah, I mean, look, the numbers sort of impose that need to talk about it because there's a lot of it, right? And listen, I think probably uncomfortable for a whole bunch of reasons. We all feel maybe we crossed the line on some level with our partners, so that makes it very intimate and very personal. Is that part of why it's uncomfortable to talk about?
Yeah, it could be. I think that the onus in the past, and hopefully the tides are changing a little bit, but the onus in the past was on the victim, not on the perpetrator. And so that's something that has that attachment of shame to it. And so it's like, well, I don't want to talk about this because people are automatically going to blame me. That's not based on emotion. That's actually based on fact. So you go, if you are brave enough to report it and they catch somebody and now it goes to a trial, and it just recently happened, right? In the Diddy case.
Right.
Those women were hysterical. They were getting battered by that defense attorney, and that's their job. I don't fault anybody for their job. You have to do your best job. Would it be my job? I would never choose something like that, but it's a personal choice.
So everybody has their role, right?
Everybody has a role, and like this is, and you're looking at this female defense attorney hammering these women, shaming them, embarrassing them. Who wants to put themselves through that? They have already been through this violence.
Yeah.
And now here is another set of violence.
Yeah, and I'm glad you brought up the focus was on the victim, and maybe sort of that's just natural.
I have chosen for my life's work to focus on victimization as well as recovery for, you know, people who are survivors of sexual violence. But there's a huge faction of like, these people are sociopaths. They need help. Where did this come from, right? Because, you know, nature versus nurture. Most people are not born sociopaths. That's usually learned behavior. Maybe it was perpetrated against them.
Right.
It's not excuses. It's just kind of
It's
exploring.
understanding it.
Right.
Yeah,
It's
not
exploring the
excusing it.
why,
Yeah.
right? A why something like this. And it's been the bane of my career of being able to say, like, I don't know why this happened to you.
Yeah, when you figure out the why, I mean, very often you can figure out the how in terms of how to deal with it. We're going to circle back to all this and dive in a little bit more. As we were walking in here, you mentioned that you have a background in a totally different area.
I do.
I sort of introduced you informally. You can give us all your formal titles and then a little background into how you got into nursing and then into all this stuff. So.
Yeah, so long sordid tale, I will tell you as briefly as possible. So my name's Dr.
Oh,
Amy
we
Smith.
have time. Yeah.
My name is Dr. Amy Smith. I am a nurse practitioner by trade. I am dual board certified, which means I care for everyone within the family nurse practitioner realm as well as an acute adult gerontologic sense.
So that means you're smart.
I know how to do school. Those are two
You know
different
how to do
things.
school.
My background is emergency medicine. Prior to all of this, I grew up, I was a dancer, I was an actress, and I was a singer. I still enjoy doing those things. I do them informally in my home. I don't do them
I'm looking at you, which you know is a sore point. I'm going to bring this up
I
on
know
air,
exactly
right?
what you're going to say. And so
Jumping
I
in.
started doing that when I was 3 years old. So
Oh,
I was
well,
a
I just want
dancer.
to tell people why we're laughing, because I've been inviting Amy to come. We have an assisted living center out in East Northport, the Atria, that a good friend, Mitchell Nesnoff, and I have been going to and doing sort of a variety show for a while. Amy, we just can't get her there. she's just too busy. But anyhow, go ahead. Yeah.
I am. Fridays typically is a work day for me. However, I started actually doing all the performing stuff when I was very young. And I think my parents recognized that my personality may have been a little bit different than my siblings. Definitely, I am an outwardly projecting human being. I'm an extreme extrovert, actually.
She is. I could attest to it. It takes one to know one. Yeah, go ahead.
Exactly. That's why we're friends.
Yeah.
So from very young, from 3 years old, I was in ballet class, tap. I danced for well over 30 years. I then was in acting classes. And I did a lot of singing. I did a lot of stage performing. And this was from very young. I was a model for a while as a young child as well. And, I did that. And I went to School of Performing Arts, which for those old enough to know is the Fame School
from
in
the
Manhattan.
Movie. Yeah.
A lot of friends of mine are still very active in the business. They're out there. They are working actors in the biz. I have a lot of people who've gone into radio, who've gone into television, who've gone into, all different types of areas. When I was in my young 20s, I left college with my first degree in looking at the fine arts, which is a lovely, however useless degree for me personally, because, was I ever going to be a giant star? Probably not. Probably not. I had a lot of pushback. I went to Hollywood. I did, pilot season. I did a lot of stuff, and I got some good callbacks. I went to producers a couple of times.
But there's just a lot of talented people out there.
There's so many talented people.
Yeah.
And it's
my wife's a professional dancer. We know a lot of musicians and dancers and whatever.
It's a very tough biz. There's a lot of things that go into it in terms of being a chosen one. And, I was more of an onstage Broadway performer, so Hollywood was not exactly my forte, although I gave it the college try, and I really, really did try. And
you said you could have been Jennifer Aniston,
right? That would never happen.
No,
who is an amazingly lovely human being. We went to high school together, yes. And she is an absolutely, literally the kindest, sweetest human being, aside from being who she is and her talent. Literally, I can honestly say from a personal standpoint that this is somebody who you would meet and be like, I never expected the personality to be like that.
Now, you still have her number so we get her on the podcast.
That's a hard ask. I ended up having some real issues in my early 20s, and I didn't know who I was and where I was going. And, in Hollywood, I was too Hispanic looking to be white, and I was too white looking to be Hispanic. And I kind of fell into this no man's land of yes, you have talent. However, what do I do with you? If I put you with a group of white people, people are not going to believe it. And if I put you with a group of Hispanics, they are also not going to believe it. I really fell into a no man's land. And that was really the landscape of Hollywood at the time. It could still be.
You could have played a nurse, right? I mean, I'm not a nurse. I play one on TV.
In the 80s, or actually in the 90s, there was a show, a pilot that was done called Nurses. I don't know if anybody remembers that. I actually went all the way to producers for that show. So ironically, I was not a nurse at the time, and I wasn't even interested in medicine. So I think that that's hilarious that actually was a show that I was being considered for.
Interesting.
And so I digress. So anyway, I kind of was thinking to myself, if I weren't doing this, if I weren't in the biz, and if I weren't dancing, if I weren't doing all these things, what else would I like to do? And so I was talking about it with my sister one night, and she was like, I'm thinking about going to medical assistant school. Would you be interested? And, at least try. And I was like, sure. Not only did I fall in love with medicine, I actually had aptitude. People were like, you're really better at this than what you're going to be doing in this particular field. And I did do that for over 20 years, and mostly in plastic surgery and dermatology, which I love. Skin is still my favorite organ in the body.
Largest organ?
Largest organ. Can't live with half your skin. You can live with one lung. You can live with half a liver. You can live with half your stomach. You cannot live without half your skin. So I really fell in love with that. And then one day I was in the OR, actually, in a plastic surgery office that I was working at. And the anesthesiologist, who is still a dear friend to this day, said, can I say something that's kind of insulting but also a compliment? And I was like, yeah, I don't care, whatever. I'm from Brooklyn. You're not insulting me. It doesn't matter.
Me too.
And so he said, you're too smart for this. You should think about nursing school. I'm too old already. I've already got one kid and I'm a single mom. And it was just kind of way over my head. And I was like, I kind of like what I'm doing. And he was like, that's fine. But what happens when you kind of get to the end of what you're going to learn here? Now, where do you go? And you're still young enough to be like, I have a lot of life ahead of me to be doing the same thing over and over. So he encouraged me to go to nursing school. Simultaneously, before I went to nursing school, I was an advocate with an organization out of Mount Sinai Hospital called SAVI. It's the Sexual Assault and and Violence Intervention Program. And they train for free anyone who wants to be an advocate within the kind of sexual violence realm. These are people who give their time. They're not paid. They go through this course given by New York State. They become certified as advocates, and you respond to these calls of sexual violence 24 hours a day.
This is a hotline.
The hospital would call a hotline and say, we need an advocate. We have a patient that's been sexually assaulted. So as an advocate, you go and respond, and it's there for not just moral support for the patient, but being that liaison between the patient and the medical staff, kind of saying like, hey, where are we at? Is it okay if I feed this patient? They're starting to get hungry. And they also provide resources. In New York State, they are entitled to 2 years of free counseling. And you don't get anything free in New York, right? So it's pretty important. And I always tell patients, you may not think you want this right now. You don't have the bandwidth. You cannot wrap your brain around it. However, once you've spoken to a loved one, your clergy, your friends, whomever, and you kind of get into a better headspace, you might go, I need to have therapy about this. And I personally think therapy is important for every human being on the planet. So, self-reflection and discovery is important. And so they get those resources. So I was doing it one night. I was at Elmhurst Hospital, very busy hospital. I was in the emergency department, was not a nurse yet. It was a very busy night. And my patient, who was an acute on chronic situation, so she was somebody who was a survivor of domestic violence, intimate partner violence. As an aside, her partner also raped her. And so it's an acute on chronic type situation. And she was pregnant 6 months. She was new to our country. She did not speak the language, so she had no idea what was happening in the emergency department, and she had a small child with her. So this is an incredibly vulnerable person. This is somebody who really needs a group of people to kind of give her resources and help her through the system, which is really difficult for most of us to navigate, even if we are from this country.
Even if you know the system, like
it's still very complicated.
It's still a big challenge,
I did the best I could with the patient and tried to give her as much support and resources. I went home, and all I kept thinking was, I can do this better. I know I can be better, and I can make this better for people. It gets me choked up because I'm like, that was the moment of my why. And Nietzsche once said it, anyone that has a why to live for can figure out the how am I going to do this.
Right.
And so I went home. It was about 4 o'clock in the morning. I woke my husband up, much to his chagrin, and I said, I want to be a forensic nurse.
So you abused your husband.
I did. That was abusive. However, he is a fan of saying, I knew what I was getting into when I married a superhero.
Right.
So he's very used to me getting phone calls at all hours of the night, still to this day. I woke him up and I said, I think I want to be a forensic nurse. And he goes, okay. And he goes, so what do we do? And I said, I probably should go to nursing school.
Wow.
And that was the moment that I decided I am going to go to nursing school.
And then you came here.
And then I came here. And I didn't come here for nursing school. However, I was a nurse for years already. I went to nursing school. I graduated.
I thought you did come here at some point for nursing.
No, I came here for my graduate
Your advanced
degrees.
degree.
Yes, my advanced degrees. Yeah. But my original nursing was done in Manhattan.
Okay.
I basically found out that North Shore University Hospital, part of Northwell Health, was what's called a SANE Center of Excellence, which is a sexual assault nurse examiner center of excellence. And that's a moniker given by the state that basically says you have all of the tools and you have all the reporting structure and you have the infrastructure for taking care of these patients. And so we're going to give you this special title. And so it was a great place to have trained nurses, an organized program, kind of an interdisciplinary approach between the docs, the nurses, social work, psychology, police enforcement, the DA. So this is kind of like a concerted effort. I wanted to work there really badly because I knew that they had that there. And so I basically made myself really annoying. I applied. I didn't hear anything. And I just kept calling the department, hey, and I would make an excuse. I dropped my phone in the toilet. Maybe you were trying to call me for a job interview. Eventually, I think they were like, can somebody just interview her because she's so annoying? And I got the job, and I was able to go and learn. I was a nurse fellow in the emergency medicine service line. I learned how to be an ER nurse. Now, everybody knows in medicine, once you smoke the ER crack pipe, you either love it or you hate it. There's nobody that's like, I can take it or leave it. They either respectfully decline the chaos or they're like, I'm all in both feet and this is what I do. And that's basically where I was.
And the ER is a front line for this, right?
ER is front line. Patients, sometimes they feel overwhelmed in the ER, which same. Busy place, very loud, very overwhelming. There's lots of smells. There's lots of sounds. There's lots of things. And there's not a lot of hand-holding. As much as we try to be as kind to our patients as possible, you have short periods in bursts with people to be able to do the greatest amount of good for the greatest amount of people. Exactly. So sometimes they'll go up to a unit like labor and delivery or psych or a med surg and be like, they'll meet somebody and they have this quiet environment. And they're like, I need to tell somebody that I was sexually assaulted. That's actually what brought them in. And they were admitted for something else, abdominal pain, bleeding, whatever. I do train nurses that are in all units. Predominantly, they are emergency medicine.
And this is for all of Northwell?
I do this for all of Northwell. We acquired a
right?
whole health system,
Yeah.
Nuvance. And so
Nuvance,
we
yeah.
are well over 100,000 employees now, largest employee
In New York.
in
yeah.
New York. Yep. And I believe in the Northeast, if I'm not mistaken. Somebody
Yeah,
can fact check that.
I think you're right. We're big.
We're big.
Do you deal with, do you get involved with kids, adolescents at all?
So adolescents are considered adults in New York State in the eyes and in the setting of sexual violence. So anyone over 13, 13 included and above, is considered an adolescent/adult. And that is important because that means that a 13-year-old can come to the emergency department, seek sexual assault care services without a parent. And in fact, it is illegal for us to call their parents.
Yeah. Do you have numbers?
It's significant in New York. I'm speaking actually tomorrow at a symposium for John Jay Criminal College on forensics. And so I'm talking about nursing and forensic collection and kind of how we are approaching these patients in the emergency medicine setting. So I do a lot of speaking engagements about this kind of stuff to very specific audiences, obviously.
Yeah.
And it's a small world.
I mean, John Jay's law enforcement.
John Jay is law enforcement, but they do a lot of forensics, and so they also talk about kind of sexual violence in the criminality sense. So it's more like evidence collection and stuff like that, how we preserve this type of evidence. There's not that many sexual assault examiners in all of the country, actually. Probably under 1,000 for the whole country. It's a very niche area of nursing, and I also respectfully understand that some people are like, I respect you. I think you're amazing.
But I don't
Not
wanna,
for me.
Right.
Right? For me, it's like suctioning trachs. I could probably never be critical care.
Yeah. I mean, it gets a little messy.
It gets a little
it's not
messy.
for
It's
everybody.
right. Meanwhile, I will take care of women's health, other emergency things. I will do invasive procedures all day long. It does not bother me. So everybody's got their thing.
What are some of the biggest misconceptions about domestic violence and sexual assault?
Some of the myths would be somebody was wearing a cute outfit, so they deserved it. If that were true, I wouldn't have 95-year-old mama coming from the nursing home.
Mm-hmm.
Right? Nonverbal, contracted, in their bed, literally just not having any kind of quality of life.
Right.
Those people are sexually assaulted as well.
Right.
Right? I have men that are sexually assaulted. And regionally, you'll have a kind of a seesaw on whether or not X amount are men versus women or male identifying versus female identifying. And it depends really on the area.
Or
also,
same gender, right?
or same gender, absolutely. Right. You'll also have they're not always strangers. Well, on Long Island, I feel like the potential is there for stranger sexual assault. However, a lot of times you see more acquaintance or date rape. If you think about it, logistically, it's more of a driving place than the 5 boroughs, which is more of a walking city. So people are out there and, you can walk through the village at 4 o'clock in the morning and it looks like it's noon, right? It's dark. However, there's millions of people and restaurants are open and people are shopping. And it's so there are opportunities, that you don't really see on Long Island, which definitely has areas that close down and, you don't really see people in the street. So those are some of the myths. Some of the other myths is men cannot be raped. That is not a truth. Actually, up until a couple of years ago, the law in New York was very specific. And it was, penetration of a penis to a vagina, no matter how slight. That wording says men can't be sexually assaulted. It no longer says that. It is a more inclusive, general kind of law, and there are multiple subsets of that law. And I am certainly not a district attorney or, a lawyer, so I can't go into all of those. However, that is a myth, and I do take care of males and male-identifying people who have been sexually assaulted, and they're in all different types of communities. Those are some of the harder, actually, emotionally for me to take care of. I think there is a different type of vulnerability there because many times, and I'm talking about my generation, which is, Gen X, was definitely raised that if something happens to you, it's probably your fault.
Right.
Girls, females at the time were definitely reared that way. Are you going to go out wearing that? Because the rest of that sentence is, if something happens to you, it's your fault. Imagine the people that are supposed to love you the most not saying, I am so sorry this happened to you. That one sentence, that can change lives. Right? It's a very simple thing to say. And I am truly sorry that it happens to somebody. One of the things that I've always kept, and I think it's just who I am as a human in taking care of these patients, it never becomes rote to me. I've never had 2 patients that are the same. I've never had 2 situations that are the same. And sometimes I hear these stories, and maybe I'm even reacting as if I were their girlfriend that they were talking, because I'm like, this is unbelievable what you're telling me. I believe you, and it's crazy, and I'm sorry that it happened, and we need to figure this out however best the patient wants that.
Yeah, which is great. You have to adapt to the
I think
person
so.
and
And
the
I think when you're in
situation.
emergency medicine, part of it is that flexibility and that ability to be able to pivot on a dime. I mean, if you're good at what you do, to be able to deal with the situation at hand. And I think every ER nurse, provider, tech, whomever will tell you there's just no two people that are the same. No two MIs are the same.
no two
no two
stories.
strokes are the same. You know, it's very much like that. You have to be, and I think actually that my acting background helps me in what I do because I can be whomever that person needs. And I have an ability to be able to kind of judge, what do they need? Do they need tough love? Do they need a friend? Do they need a mom? Do they just need, like, this is a come to Jesus meeting, we need to have this conversation? And that happens. And so I think I have a good ability to do that.
Yeah, I have no doubt that comes into play.
I've sang to my patients. I've literally started humming a tune if I have one of my, demented mamas and they're super adorable and I'm just trying to get my job done, but they're combative. I'll start maybe singing a song of their era. Whatever it takes for me to get my job done and make the patient comfortable, I'm going to do that.
Now, speaking about your acting career, you mentioned at the beginning you were maybe stereotyped.
Yeah.
And just applying that to this discussion, there is no stereotype for domestic violence. So
No.
It's not any one ethnicity or any one
And
gender
it's not a
identification
financial, if there's no,
Right,
like
could
rich
be-
people don't have it and poor
Right.
people do or vice versa.
across the spectrum.
This is non-discriminatory. It can happen. There are so many factors. I mean, there's definitely research out there trying to pinpoint, and the bottom line is you just can't pinpoint where this comes from, right? There's nature versus nurture. There's situational. There's so many different things, and it doesn't define who you are. Recognizing early, coming to terms with that to be able to help the situation or at least seek help, that's the most important thing.
So early intervention, but in healthcare we talk for good reason about prevention, right?
Yeah.
How do we apply that concept to this? Public awareness, education, all that. Can we apply the concept of prevention? Just like you said,
It's
crosses. It's tough.
It's tough. So there's a lot of different ways that you can attack this problem. Obviously, there's the criminality and the law side. And that's already too late. It's after the fact. And if I were delusional, I would say I went into this to be able to cure society of sexual assault. Well, we clearly know that that's not going to happen. This is as old as time. That's not going to be cured. However, what I can do from my end is not just train the nurses who care for the patients, but going out and training communities, telling them to know their resources, what the law is. We don't care if you're legal in this country. We're going to take care of you and we're going to get you the help that you need. Again, it's after the fact, but maybe having knowledge about this, giving them resources beforehand, they can start helping their friends. Hey, I went to this talk and I know that you can call this hotline and they can help you.
Just so we don't forget, we'll mention it again at the end. Let's mention a couple of resources in terms of hotlines. The National Domestic Violence Hotline, 800-800-7999-SAFE. Are there any others that we should be mentioning?
Yeah, there's RAINN, RAIINN. That is a national organization that deals with abuse and violence and all that stuff. There are local places. The bottom line is you can walk into any emergency department if you're unsure and say, I think I need help.
So let's take it one step back. So maybe we can't prevent this, but even at the time somebody's going in with an emergency room, it's already sort of at an advanced stage. What are the signs, maybe friends, family, commonly missed signs?
I think one of the things in domestic violence is they will seclude themselves. Yes, they will be told they're not allowed to, speak with that family member, this person, go to that party, go on a trip, whatever. But eventually the shame and the fear and all that stuff becomes such an overarching daily feeling that they start to self-exclude from family events, from friends. In the day and age of social media, that's a lot easier to do too, because you can, on the fringe, watch what everybody's doing without being involved. And that is an area of seclusion that is overwhelming. It's overwhelming because there is shame to say I'm in this situation and somebody is beating me up. They're taking my money.
Right. I mean, the obvious signs, seeing black and blue marks.
In the ER, I teach the
black
nurses
eyes and stuff like
things
that.
Things that are, injuries that are disproportionate or incongruent with the story. And I had one woman who came in and she had a left hematoma over the eye, so a black eye, and she had a right wrist fracture. I said, oh my gosh, I'm so sorry. What happened? How did this happen? And she said, oh, I walked into a door jam. Unless she was walking into a door jam with her right hand over her face next to her eye, she would not have a wrist fracture, right? A decent fracture that needed repair, and this giant hematoma that's actually making her not be able to see.
So you don't need to be Columbo. You just need to pay attention, right?
And I said, that doesn't make sense to me.
Right.
I am concerned. If this happened in your home, you don't have to tell me. You don't have to take resources. However, if you need something like that, I have lots of ways that we can help you. So I'll just kind of put that out there. Some people will not want to do it, and they'll come to the ER multiple times with all different types of things and different outlandish stories before they accept help, because they don't know what to do.
Right.
And they're afraid, or they have children and they don't have a job because they are now excluded. I'm going to take care of everything. So now you're in the situation where you're like, I couldn't help myself if I tried.
Probably tons of reasons, right? Or they're conflicted because this is somebody they otherwise love. And
and emotionally, it's like you want this person to care about you. And so you don't want to get them in trouble.
Right.
Even at your own detriment.
Tremendous conflicted dynamic. We're here in New York State. You're dealing with New York State largely. Do you know much about what's going on in the rest of the country? I mean, I know we could expand it globally. That's another whole topic, right?
I don't know, data, just, from what I heard, since there are so few sexual assault nurses around and people just don't have programs and facilities don't have programs. It's not a mandatory program to have in your emergency department. There are people in states that have zero care. They have to go into a different state if they want to get that kind of care. That's criminal. That's insane for a country that, touts itself as, being a superpower and being a number. We are woefully behind the times when it comes to taking care of these patients. I don't think it's because we don't have the resources. I think it's because people don't have the bandwidth and they don't care.
So in terms of resources, what are we doing here at Hofstra in terms of training?
So we were fortunate enough.
You're a big part of that, right?
Yeah, I am the program director for the Sexual Assault Nurse Examiner program. It is a continuing education program. It's a 40-hour course sanctioned by the New York State Department of Health. So when you finish it, you are a New York SANE certified nurse. Mm-hmm. We were operating initially under a very large governmental grant from HRSA. It was a $1.2 million grant that we've been administering since 2019. Yeah. Unfortunately, many grants dealing with sexual violence, diversity, and marginalized people have been ended, including my grant. But in that time, we have really done, I think, a good job of bringing nurses in, and not just from Northwell. We bring nurses in from any hospital that wants training, and they were able to go for free. Normally, this is a program that costs about $1,000 per nurse. And so if your facility's not willing to train you because they don't have a budget for it, which I get, nurses will pay that out of pocket if they wish to do this. And a lot of times they're just like, I would love to do it. I just physically can't afford it.
How much interest is there? So, I mean, you're obviously passionate about this and doing a good
I would
job.
do it for free everywhere.
Yeah. So how much interest do you see?
It's cyclic. It's like feast or famine. Sometimes I'll have a class of 30. Sometimes I'll have a class of 10. I'm happy to teach anyone that has the interest, because if you have a passion or you have an interest or you have any care in your heart about these patients, I can teach you the ethics. I can teach you how to collect evidence. Yeah. That's the easy part. I can't teach passion. I cannot teach that kind of, empathy that you should have for somebody else's suffering. That's tough.
So for anybody out there who might be interested, how do they contact you if they want more information?
So I am hoping that our next class is going to be late spring of 2026. They can go on my website, which is www.hofstra.edu/sane. It will take you to our website, and you can apply. You can also inquire if you have any questions about
and that's
how...
S as in Sam, A...
S-A-N-E, yes.
Yeah.
My husband likes saying I am not a sane nurse, but I am an insane nurse.
Right, yeah.
And that also has merit. So I'm just going to throw that out there. But they can absolutely, right now I am accepting applications. We are holding them until for the spring if anyone's interested. I need 1 year of nursing experience. It does not have to be emergency medicine, because there are lots of opportunities outside of a hospital to be on call for this type of situation, like kind of a side per diem thing. All you need to do is care about people suffering. I think that if you have that, I can teach you the rest of it. The rest of it is very easy to learn. It's what comes from inside of you. Yeah. I can't teach you that.
As with the rest of healthcare, right?
Right, exactly. Really, so. If you don't have a vested interest in people that suffer from this, that, or the other thing, it's going to be boring to you.
And with that, unfortunately, we have to bring this to a close. This has been incredibly informative.
Thank you.
And I just want to thank Amy Smith
Thank you so much for having me.
For doing this. This has been another hopefully very informative episode about a very important topic, Nurse to Health, brought to you in collaboration with the Hofstra Northwell School of Nursing and Physician Assistant Studies, and as always with the able support of the best in the business, John Mullen. And with that, stay well until next time.